Health, Wellness, Lifestyle TV. I'm your host, Tammy-Lynn. We're going to take a step away from my usual topics, which is great food, how to eat healthy, maybe a little bit of exercise, and talk about a subject that I think is long overlooked and not talked about, and that is sexual health for men and women as we reach our 40s and 50s. And I think that being 40 and 50 today is much different than it was 10, 15, 20 years ago. I know that when I wanted to do this episode 5 years ago, it was a subject that was somewhat taboo, but nowadays I think that talking about our sexual health is something that's good and healthy, and we're entitled to know a bit about each sex and how it impacts not just them, but us as well. So today I've brought together a panel of experts in their own right to do with sexual health. And I look forward to having just like a casual roundtable type conversation. Each of you knows sexual health very well. And I'm hoping to have some dialogue so that you can understand better what it means and don't feel like what you're going through is anything but normal. Welcome to the show, everybody.
Thank you.
Thank you.
Thanks for coming.
Thank you.
So I want to talk with this person first, and everyone jump in if you have something to say. But Kim, you're called the Vagina Coach. I remember when I met Kim several years ago, it felt weird to hear the things that she was talking about because it wasn't a common practice. Give us a bit of a journey as far as women's health and talking about the vagina so freely.
Yeah. Well, it's certainly not something I grew up thinking that I would become,
Right.
a vagina coach.
Yeah,
but
nor did your kids, I'm sure.
nor did my kids. They still haven't embraced it. But
No, I'm sure.
But going through pregnancy and childbirth was a really pivotal time, as it is in many women's lives. And I recognized that pelvic health needs a place in the conversation of prenatal and postpartum recovery. So that's really where I began. But then as I navigated perimenopause and now postmenopause, I recognized that pelvic health really is a conversation that needs to happen even much earlier than pregnancy and childbirth. But we need to understand all of the changes that happen as we age and how we need to navigate that and also work with a healthcare team to support us through that.
Talking about healthcare teams, I mean, how often do people come into your offices? Let's start with the women, first of all. Do you get a lot of women more these days talking about their menopause journey? I'm hoping you say yes, and it's probably going to be no because we're still shy about it.
I would say more so now because there's more exposure, more education, so people are actually coming out of the shell and they don't feel so insecure about talking about it. So I would say yes.
How has it impacted you as a doctor? I mean, you're a man and you're a doctor. Do you feel that we've come a long way when it comes to options for women going through menopause, or do we still have a long way to go, do you think?
Well, I think the first thing is that we are discussing issues that we're sort of embarrassed to discuss to begin with. Women's sexuality, men's sexuality, for instance. And now there is on the forefront with HRT, hormone replacement therapy, over-the-counter therapy. We are seeing a progression in things that we could utilize to help people with these issues. So it is slowly evolving.
I talked to you before about hormone replacement therapy, and it's a situation, a field that you've been involved in the past. Talk a bit about where you've seen it in the past and where it is today for hormone replacement therapy.
Well, I took an interest in it just because of menopause, actually, and how complicated treating it is. Actually, all of women's health, it's very complicated.
It's not a one size fits all.
No, so it's
Are you calling us complicated?
yes, women are complicated.
Yeah.
Men are simple.
Yeah. But yeah, even medically speaking, women are so much more complicated. And I guess for me, it was just interesting, and I wanted to learn more about it. And it's something that, a lot of doctors or a lot of people might not fully understand. So, hopefully we can clear a few things up.
Do you think that we're lacking in the Canadian market, even the North American market? I mean, if I go online and look up menopause, perimenopause, erectile dysfunction, there seems to be so much conversation and organizations happening in the UK and Europe and less here. Do you think that there's more that can be done? I mean, there's not a menopause clinic for women to go to, whereas in the UK, that sort of thing exists. Is there a need for that, do you think?
Well, I'm sure. I mean, that sounds great. I actually wasn't aware of the UK having menopause-only clinics, but does anyone else know? Yeah.
Yeah, and they're actually, a lot of people around the world are looking to the UK for inspiration because they now have also approved local vaginal estrogen over the counter. So people don't have the barrier of needing to speak to a healthcare provider each time. So I think that adopting practices like that around the world is going to open up that conversation even more. But to kind of your original question, I think that there is a lot more conversation happening around perimenopause and menopause. There's a lot of celebrities even coming in, which is great from an awareness perspective, but there still is a lot more work to be done to direct people to somewhere where they know they can seek help from qualified practitioners. Because I think that it's not the evolution of hormone therapy as just one piece of menopause has changed drastically over even the last few years, and more research is happening now. So I think that they're having a collective identified clinic specifically for that specialty would be really helpful.
For sure. Leilani, your company develops green, clean skincare products, and now you've ventured into products specifically for women during the perimenopause and menopause journey. Why that? Why? I mean, I see other companies doing the same thing, but what makes women's skin so different in their 40s and 50s?
Lots. I mean, first of all, I got a better understanding of working with the cancer, burn, and trauma surgeons and understanding what skin went through while undergoing all these conditions. And menopause is a condition, yet another condition. And, you know, we're dry on the inside out. And it's, a lot of people talk about the skin more because they're more comfortable talking about it, but there's still issues like hot flashes where some women are perspiring like running down their face, and they're looking for skincare or cosmetics that are waterproof or
stay in place. Can you imagine waterproof? Yeah.
Yeah, and now creating products that aid in calming those hot flashes, calming these skin conditions. And furthermore now, because I am a formulator, we're on to all these other bigger, better things for salves and, you know, lotions and stuff for the vagina, because the face and the vagina literally mimic each other with the skin.
Yeah. I find it really interesting too that, you know, as we talk more about menopause and perimenopause and vaginal dryness and lack of sexual drive and all the things that makes you feel like less of a woman, we realize that we're in super good company, because every single woman, almost every woman in the world will go through menopause. I think the same holds true for erectile dysfunction. It's just a topic that men don't want to talk about. Maybe the two of you can talk to that a bit about the effects on men.
I think men in general, when they equate to sexuality, they think of themselves, if they can't perform, then they feel like a less of a man. So it's one of those discussions that's not very openly discussed even in our treatment rooms. It's not a discussion of comfort, let's put it that way.
Sure.
So I think now what people are getting to understand, that erectile dysfunction is a condition that affects a lot of men, even ranging from 30 to 40 to 50 now. So it opens up a little bit of confidence where they can discuss it. They don't feel like they're challenging their masculinity. And so now on the forefront of more information, more knowledge, people are a lot more comfortable discussing it, which is good because it helps them.
It's very good.
And plus, at the same token, it helps their partner as well. So it's important.
We're going to cut to a quick commercial break. When we come back, we're going to talk a bit more about how partners can be more aware of and sympathetic to what their partner is going through during their menopause and andropause journeys. We'll be right back. Welcome back to this special episode of Health, Wellness, Lifestyle TV. I'm Tammy-Lynn. We are going off script today, and we're talking about a taboo subject. We're talking about men's and women's sexual health, and we want to, in some way, take away the stigma and normalize it. And here I have my panel of experts. I want to dive right into women going through perimenopause. I think a lot of us don't know what to expect. We don't talk about what to expect. Tell us what happens to a woman as they're going through perimenopause and menopause.
Well, essentially, you stop making hormones, female sex hormones, so estrogen, progesterone, which are very important in the physiology of a woman's body. And once those hormones are kind of gone, your body responds in many different ways, and some of them can really affect your health.
I think that aside from the physical aspect of vaginal dryness, the thinning of the inside of the vagina walls, which can make sex painful, what other things are they going through? What can they potentially expect?
Well, when you lose estrogen and progesterone, one of the main things that is undiagnosed, I feel, is vaginal dryness or vaginal atrophy. And,
Can we just use a different word? Because the whole idea of vaginal and atrophy, it's so, don't you agree? It's almost like it's offensive. It's like, okay, my vagina has died. Yeah. So we'll just, okay. So anyways, vaginal atrophy, doctor, yes?
yeah, that's the medical term.
Yeah, I know it is.
But,
I know it is.
That affects, sex life. It affects quality of life. A lot of the time, patients are complaining of itching, pain with sex. I think Kim might be good person to talk to about the vagina. So maybe as a doctor, we think about osteoporosis, we think about coronary artery disease, think about depression, mental health. And I think pelvic health and sexual health kind of get left behind.
You mentioned in lack of sleep as well.
Which is a big one. Hello. I mean, I can think of, the last couple of years, like truly, sleep has evaded me, and you think it's stress or your kids or relationships or whatever it is. And a lot of it is to do with menopause.
And when you think
sure.
about sexual wellness, sometimes it may be because of erectile dysfunction, or it may be because of vaginal dryness or changes in the body. But sometimes we can also bring it back to sleep. When we're not sleeping, we don't feel well, and we don't have the energy, and it's the last thing on our mind. Then the changes in hormones also can directly influence our libido, and it's very common for women especially to have a lower libido as well. So when you add that to then the other list of the work stress and potentially relationship struggles now, because maybe we're not having sex because it hurts me and because my husband can't get an erection anymore. And there's this divide, and then we've got sometimes children and aging parents. And so there's this big, long list.
Huge list.
And everything just kind of gets compounded, especially when we're not sleeping.
I just find it really hard to think that, let's say the woman's going through menopause and she's suffering vaginal atrophy. Somehow the husband feels like now that she's not attracted to him anymore, or that she shouldn't talk about it because he's not stimulating her. And it has nothing to do with the husband. Same way with the men. If a man has erectile dysfunction issues, it's not because he doesn't love her or is not attracted to her anymore. He is having a physical issue with ED. Can you talk a bit about ED, what a man's going through?
Well, if you look at it from a physiological perspective, what causes ED, first of all? I mean, there's different components to it. If you are diabetic, high blood pressure, unhealthy, overweight, don't exercise, that's going to sort of lead to developing erectile dysfunction just because of lifestyle and health issues. But then there's also that reality is as we age, what causes an erection is blood flow. And then you have a reduction in arteries in the penis itself. So you have a reduction in blood flow into the sponge, which causes an erection. And so now when you were 16 and you had an erection, it was robust, you feel confident. But as you get older, it's not as robust. You may not be able to achieve an erection long enough, which now affects you psychologically, because now you feel like you can't perform. You're not as masculine as you once were. And that takes a toll on you. So erectile dysfunction is not necessarily just having an erection, it affects your psychological ability to provide love, be able to provide a performance that creates intimacy, which creates a relationship. Just like Kim mentioned, a woman with vaginal atrophy or dryness may not want to have sex, and hence the male will feel as if he's not desirable. But in this case, he's worried that the woman doesn't think that he feels that my spouse is not desirable for me because I can't get an erection. So it becomes really convoluted and it sort of evolves.
think it's important for couples to try to talk about a subject that's embarrassing. Maybe those conversations are too personal to have in the past, but certainly moving forward, unless your partner knows what you're going through, they don't know what you're going through. You know, you'll always see that husband saying, I have to go to the bathroom before, and then he's like taking his ED medicine. I mean, it shouldn't be as taboo as it is. And I'm hoping that it progresses.
And when you say that people aren't getting diagnosed, like, I think that's a big issue, because I always hear women say, I don't feel right, but what do I go and ask for? What am I, like, what tests are there? What should I be asking my doctor?
I mean, that's a little bit difficult, and I'll explain one reason why. From a physician's perspective, our training, you'd correct me if I'm wrong, it's sort of limited in men's and women's sexual health. So our ability to have, when a patient does come in and they're very not forthright, but they're just sort of giving little bits of information because they feel uncomfortable, shy, we don't pick up on it. So that's a drop of the hat right there. We're dropping the ball right there because we're not picking up because there's a lack of training. Now, some people have taken personal interest, so they develop the training, so they're able to tease that kind of information out, make the patient feel comfortable, and be able to diagnose them properly. But it's not mainstream like high blood pressure. You check your blood pressure, it's high, give them medication, you're done with it.
Do doctors go out of their way to look at a patient's file and say, you know, do you say, hey, you're getting close to being of that age of, do you have these conversations, or do you wait for them to talk to you?
I think, first of all, Tammy, we have limited time in an office visit, and going through someone's chart, it's very difficult. So we like that the patient take the initiative, but a lot of patients don't, unfortunately.
Yeah.
Well, I find a lot of patients, or just from what I hear, like say if someone's looking for a prescription of Viagra, they haven't told anyone. Like, you're the first person they're kind of telling a lot of the time. And I don't know, it shouldn't really be that way. There's nothing wrong with asking for help for that.
Can I tell you? My family's gonna hate this. I was at a family event and there was this pill packet on the floor. I picked it up and put on my readers, and it was Cialis. And of course, me being who I am, I'm like, hey, did somebody drop their ED medicine? And every man in my family was like dead silent. My mom's like, you're awful. But yeah, I mean, no one claimed it. So you're right. It's a situation where it comes down to, it should be more of a normal conversation.
This is very similar to the 18-year-old that went to the pharmacy to get a pack of condoms.
Sure.
He's making sure no one's watching, and he's by himself, and he'll go there with the magazine and pay for it. Same thing with ED. There's a big, what do you want to call it? Not a myth, stigma attached. Because not only are you buying a medication, it means you're not masculine enough to have an erection. And the last thing you want to do is be in line asking for Cialis, and there's a line of 5 women behind you.
Right.
Right?
So
That you may or may not know.
So even more reason for these clinics that are in the UK.
Yeah.
Well, you bring up a great point with regards to the time. The doctors may not have parts of the training, but also the time that they have to really explore a topic is just not there. And so I think if we can find a way to build collaboration between different providers, and also again specializing in, like, having specialized clinics where there is maybe some model that people have more time to explore with. I think sexual wellness and you know, pelvic health and what have you should be a vital sign, really, as part of the normal checks that we go through. But
I think a lot of conversation around these subjects as well. There's a lot of proactive things that women can do. I mean, if they know what to expect, they could be taking care of their pelvic floor area very differently in preparation for potentially reaching certain issues that they have that could take a lot of time to unchange the damage that's been done as well. It's not a simple fix. Like you said, we're very complicated.
Yes, very.
You know?
Yeah.
Now, are men as complicated? I mean, we're talking about
very simple.
with ED?
Very simple.
Just a 25 mil, 50, 100, off you go, that's it.
That's it. And there's some other new therapy, shockwave therapy, that can help as well. But men are very simple. But I think, you know what, in reality, what I think we need to understand is when you get older, it doesn't mean you're not sexual anymore.
Correct.
That's the biggest problem. I mean, with parents, I don't want to think of my parents be engaging in a sexual relationship.
No.
It's-
See, we have parents too. Ah.
We don't want to think. And I think there's a stigma attached that as you get older, your desire for sex should diminish, but it shouldn't.
No.
I think it's very important for a healthy relationship that if you're engaged in a sexual activity to a couple, it's healthy. But we need to break that barrier and create that exposure that it is normal behavior and it's a healthy behavior. So having said that, ED is a normal thing that men go through. Menopause is a very natural course for women, but how can we help so then you can have a healthier sex life with your partner?
And to bring it
doing it
back
right now.
to what you were saying earlier about the communication between the couples so that they both know that they're going through issues and it's nobody's blaming anybody or thinking that you don't love me or I'm not attracted
Correct.
to you anymore.
Yeah.
And building on that whole conversation.
Yeah, because your personal suffering, and I'll say suffering because menopause can be quite traumatic for some women in their bodies and their mental health, impacts their partner substantially, and vice versa.
And I also think that by discussing this, it'll also create closeness because you are talking about something that's very personal.
Yeah, it's definitely, it's definitely intimate for sure. And I think that women have to also get through, I'm not shy, but certainly, seeing my gynecologist who's also a friend of the family and that's tough in itself. But we're shy about having to share with people that are taking care of us that we are feeling maybe less than as we're going through this journey. So it's an important topic. So that's it for this part of our show. We're going to do another episode as well. If you have any questions or comments, you know how to reach us through social media or through our email address. Great conversation. Thank you so much for taking time to meet with you. I appreciate it.
Thank you.
Thank you too. Cheers.